Every civilization has to answer the same question, whether it says it out loud or not. What should we do with the anxiety that comes from not knowing what will happen next? Not how do we eliminate it, because no civilization's ever managed that, but how should we relate to it? How should it be interpreted, disciplined, tolerated, or transformed? Modern culture has given one answer: anxiety is a problem to be solved. That answer isn't wrong. We now have tools that reliably reduce suffering, restore functioning, and prevent people from being overwhelmed by fear, panic, or chronic worry. This approach is necessary. But something different's been happening over the last few decades, especially for people whose anxiety is chronic but not incapacitating. People don't collapse, they stabilize. But many people notice something unsettling. They become more cautious, less confident in their own judgment, more reliant on guidance, reassurance, or structure from people outside of themselves. Not because they're weak, but because anxiety has been framed as something that they shouldn't have. Let me say the core claim plainly: anxiety is not a defect, it's a normal human response to uncertainty. I'm Doc Rock. I'm a licensed counselor with a PhD, and I've spent many years working directly with clients. This channel is about understanding psychological patterns clearly without hype, gimmicks, or pretending complex problems have quick fixes. If this kind of work is useful to you, hit like and subscribe. I also publish a short newsletter on the first Monday of each month with updates and deeper material. You can find the link below. And just to be clear, because the internet makes this necessary, watching a YouTube video is not diagnosis, not therapy, not a substitute for professional care. This is education, it's not treatment. If it were treatment, there would be paperwork and forms and probably a copay. So let's get into it. What differs across culture is not whether or not anxiety exists, but what people are taught to do with it. Older traditions didn't treat anxiety as something to eliminate. They treated it as something to be understood, or disciplined, or integrated into a bigger view of life. They started from a premise that our culture resists. Suffering is normal. Not good, not virtuous, not something to seek out, but normal and formative. Loss, illness, uncertainty, rejection, failure, these are all negative events. They're not thinking errors. No amount of reframing makes them disappear. But how tightly we cling to certainty, control, or imagined outcomes determines whether suffering becomes corrosive or instructive. Stoicism trained people to notice how judgment amplifies distress beyond the circumstances. Buddhism trains people to see how attachment and aversion magnify pain beyond necessity. Neither one denied suffering. They denied that the goal of life was to eliminate it. Now, contrast this with modern approaches to anxiety, or at least what they communicate, even unintentionally. Anxiety is framed as something that shouldn't happen. It's a malfunction, a signal that something might be wrong with you. Over time, this shifts anxiety from signal to defect. And when anxiety is treated as a defect, other assumptions follow. There's nothing to learn from it. Life should be lived without it. Someone else should help you manage it. It's rarely said outright, but it shows up structurally. More monitoring, more reassurance, more techniques, more emphasis on safety and stabilization. You begin to relate to anxiety as something that exceeds your capacity. And that's where the rescue reflex begins. Rescue feels compassionate until you see the cost. Consider something that happens commonly. You feel anxious about making an important decision. Nothing catastrophic, no imminent danger, no, just uncertainty. The reflex is often to move quickly towards relief. And what's the thought? How do I calm this? How do I make it go away? What if anxiety isn't a malfunction? What if the natural consequences of facing a real trade-off, security versus meaning, comfort versus integrity, approval versus autonomy? When anxiety is reduced without being understood, a lesson is taught. Uncertainty is not tolerable, or someone else needs to help you manage it. Consider social anxiety that gradually leads to avoiding more and more situations. The goal often becomes exposure, but exposure aimed narrowly at reducing symptoms gets missed. And what gets missed is a deeper question. What kind of person am I becoming as avoidance expands? Not just less anxious, but smaller, more constrained, more cautious. Older traditions ask the different question. Not how do I feel less, but what is worth suffering for? That question changes everything because meaning clarifies suffering. And without meaning, anxiety is pointless. With meaning, anxiety becomes informative. This doesn't glorify pain or deny the distress. It recognizes that some discomfort is the cost of being an adult in an uncertain world. When anxiety is treated as something to remove, the result is often compliance, not capacity. You learn how to manage symptoms, but not how to bear responsibility for choices. And that's how dependence grows. Not because you want it, not because anyone intends it, but because you're taught implicitly not to trust yourself with discomfort. Now, precision matters here. Some forms of anxiety absolutely require medical and clinical treatment. Panic attacks, trauma responses, biological vulnerabilities. Ignoring that's irresponsible. But when the model expands beyond its proper scope, a category error occurs. Anxiety is treated as something to remove rather than something to integrate. And instead of strengthening your capacity to face uncertainty, the work becomes a buffer between you and that uncertainty. And that's exhausting. It's not sustainable. Helping isn't rescue, it's strengthening. Not removing anxiety for you, not managing life so you don't have to, but restoring your capacity to tolerate, interpret, and act responsibly in the presence of uncertainty. That requires resisting the reflex to fix. It means staying with discomfort long enough to understand it. It requires curiosity, not just about symptoms, but values, commitments, and avoided responsibilities. Curiosity is not passivity, it's discipline. Responsibility is not abandonment, it's returning anxiety to its proper place, not as evidence of failure, but as evidence that you're confronting reality. When anxiety shows up, the most important question isn't how do I make this stop, but what is anxiety responding to? What demand is being resisted? What capacity is trying to be developed? If anxiety's always been part of being human, then the task was never to eliminate it. The task is to become someone who can grow through it without outsourcing agency to someone else. If this is useful, you can support the channel by liking the video and subscribing. You can also sign up for the newsletter below. I send it on the first Monday of each month with updates, context, and material that doesn't always fit cleanly into a video. As a reminder, this content is educational. It's not diagnosis, it's not treatment. It doesn't replace working with a professional when it's needed. Insight's powerful, but it's not magic. And YouTube doesn't get malpractice insurance for a reason. Thanks for spending the time. I'll see you on the next one.